I grew up in a small rural town about 50 miles from here. Actually, I'm a farm boy, and so I enjoy the rural settings. I've been here 20 years. It's hard to recruit practitioners to rural areas. It's kind of a culture shock. If they like it, their spouse may not, or it might be the other way. Frequently they just leave and we have to try to find someone else. So it's an ongoing struggle. Our situation here is that a medical center has within it a clinic, a hospital, and a nursing home. In a rural area, you're kind of there by yourself. You need a specialist. Usually you can contact someone by telephone, but of course that's not the same as being there.
We have 14 rural counties in Colorado that don't have a hospital. So the community members that live in those counties have to travel sometimes up to 200 miles to access inpatient hospital care because they don't have a hospital in their local community or in their county. A family physician working in a rural clinic in a rural community in Colorado is actually doing orthopedics, pediatrics, geriatrics, and many other specialties.
The cost of medical care seems to be escalating, and I think everybody agrees we cannot continue the present system indefinitely. We just cannot afford it. At the same time, in the rural setting, it seems like it's difficult to keep up with the technology.
In our rural healthcare system, we have a shortage of healthcare professionals. We have a shortage of funding. We don't have access often to the latest equipment and resources, training, specialty care. And all of those factors contribute to the cost of providing care in a rural community. It's extremely expensive to provide obstetrical care in a hospital, but routinely we have many hospitals that are discontinuing those services, and a large part of that decision is based on the malpractice cost.
It would be wonderful if we could figure out how to get everything we need right here in Julesburg, but it's just not going to happen. So what we hope always happens is that you have a staff here at this hospital that will continually work to upgrade what they can do and get us where we need to be.
Oftentimes our rural health professionals don't get to take time off because they don't have coverage. So it's a challenge for them to meet educational requirements and to be able to take enough time off to have a healthy balance between work and family.
Obvious challenges of practicing medicine in rural facilities is typically access to diagnostics, access to specialists, higher level of care, ICU, things like that. Patients have to travel if they want to see somebody.
The communication in the rural community is a lot better, and that sometimes works both ways. When you're seeing a patient in the clinic or hospital, it's better. You know their names frequently before you see them. You know where they work. You know kind of where they're coming from. But I guess the downside is they see you in the grocery store and they say, "Hi doc, how did my test come out?"
For instance, I saw Dr. Regier today. Well, I had Dr. Regier's kids in school when I taught there, so I've known Dr. Regier for a long time, you know. Linda the nurse, worked with me in Big Springs when we did migrant school in the late 70s. So, I mean, it's like I have a real history with these people.
I think my favorite part of practicing in a rural area is just getting to know the people. I know on the Eastern Plains here in Colorado, it's a real tough time. Hospitals try to keep up to date with equipment, but it's hardly affordable. So it does impact the overall health of rural communities, and I think probably in a pretty big way.
Looks great.